Hi, I'm Harlan Krumholz, editor JACC, professor of medicine at Yale University School of Medicine. Here with another faculty member, professor at the School of Medicine, Ania Jastreboff, who's also one of the leading experts in obesity medicine and a good friend. And I want to just talk to you just quickly about this issue of people with obesity and this sort of shame and blame. You know, these patients come in having often tried thousands of different strategies, feeling that they failed. They failed to actually manage their obesity. They've struggled with it for years, and society is looking at them as failures. We've got lots of studies showing discrimination against people with obesity and a whole range of issues. So you're an expert in this. Help us think about this. What can we as physicians be doing? How sensitive should we be to this? What are you thinking?
Yeah, I think we should be very sensitive. I think we've contributed to this as healthcare professionals. We have asked our patients to eat less and move more for years. We have blamed them for a disease that is not their fault, and we have basically asked them to self-treat for a disease that has clear underlying biology. I think there are many things that we can do to shift the culture from shame and blame to one of compassionate care. And it's our responsibility to do so. And one of the things that we can start doing is to share the biology of obesity with our patients so that they are released from that shame and blame that they have faced their entire lives, and let them know that, look, their bodies are really smart. They're doing exactly what they were designed to do, which is to make sure that they store energy, and to store that energy as fat. And fat is not a bad thing. It's just that when we carry too much fat, that may impact our health in negative ways. And so really sharing that biology and ensuring that our patients know that we're here to help them to target that biology, and to help them treat that disease is really, really key. I
I mean,
think,
this is evolution, right? I mean, look, we were prepared to deal with starvation, periods
yes,
of where food was scarce. And so actually probably in history, having the ability to store fat was a survival characteristic. It's just that in modern society, it's turned the other way.
that's exactly right. That's exactly right. And, patients sometimes laugh and they're like, great, if there was a famine, I would survive. But that's not a good thing in this current obesogenic environment. And that's exactly right. But when you share that biology with patients, you invite them to share their own struggles, their journey. Something happens. Something,
It can release
yeah,
them, right? I mean,
it,
and it
frees.
makes sense to them. I mean, what I found is when you start talking to people about this, all of a sudden they're going like, yeah, that makes sense because I've tried so many different things. I mean, I've never felt it was only about willpower, but I
Yeah.
felt that, my body is working against me, not enabling me to get this sustained
Yeah,
success.
exactly. And most patients, it's not that most people can't lose weight. It's that we can't keep it off. And the reason why patients can't keep it off is because their biology is so strong. We are literally engineered to hold on to energy. And so it's reassuring patients that their body is actually doing exactly what it should be doing. Again, it's just responding to this obesogenic environment. So as we've talked about previously, that means, hey, we need to work on our obesogenic environment. We cannot have this environment that is filled with ultra processed food and stress and lack of sleep and all of these other negative things. We need to work on our obesogenic environment. But at the same time, we also need to provide our patients who already have obesity with the treatments that will help target that biology. And we're going to do it together. So in the same way that we would not ask our patients to meditate to make their blood sugars normal, or meditate to make their or concentrate really hard to make their blood pressure normal, we need to do the same for obesity. We need to say, look, I'm not going to ask you to concentrate on every morsel of food that you're going to put into your mouth for the rest of your life. I'm going to give you a medicine, or I'm going to give you a treatment that is going to help target your biology. And in so doing, we're also going to be focusing on healthy food choices and physical activity, but we're going to target that biology with you.
We're going to give them the opportunity to treat it
That's right.
again if it's consistent with their preferences, values, and goals. But
That's right.
we're going to be proactive about saying we now have something that can improve your cardiometabolic health, can help you treat the obesity, and is likely to have benefits across a broad spectrum of conditions.
Yeah. And I think you raise a really good point there with what you just said, which is that it's the opportunity. And every patient will not want, medications or surgery or additional other treatments. And that's okay. That's okay. That, it is our patients' lives and it is their choice. And we're basically here to talk about the risks of treatment or the not risks of treatment. We're here to talk about the benefits of treatment or not the benefits of treatment. So we're here to basically let them know that these options are here, and we're here to help them with whatever choices that they make, and we're going to support them with whatever choices that they make.
In the same way we would treat hypertension, meaning that we would say these are risks. There's a dominant benefit if you want to go to treatment. Some people still want to try lifestyle for a period
Yes.
of time, but it's
Yes.
important that we inform them so that they're making choices that where they fully understand what the opportunity is in front of them and what the issues are. The other thing for people today is cost. So, we've got to work hard to make sure that these drugs are accessible to people and that doesn't become a barrier. There's a proposal about Medicare now paying for these drugs for obesity. It is so important that people can make these choices without feeling that they are compromising their economic health, that this doesn't become a threat to the economic well-being of their families and themselves. And so this is just another feature of this too, that we have to be tuned into, not just writing scripts, but also understanding the context and advocating. If we've got a med that can really reduce cardiometabolic risk and improve cardiovascular health, let alone all these other benefits, we have to be proactive in making sure people have the opportunity to have this without the financial toxicity of large copays or other impediments to their access to these medications.
I agree. And I mean that the biggest thing is the patients who need these treatments the most may be the ones who actually do not have access to them. And so if we don't actively work to make this better, we're just going to increase the health disparities. And that's exactly what we don't want.
And I'll just say at JACC, as we approach this, publishing papers in this area, raising awareness, informing clinicians throughout, we also need to be focusing on the advocacy to ensure this doesn't increase disparities. It doesn't create two-tier system, doesn't create people who would markedly benefit from these medications, but have really no way to access them or can't afford them. So all of this is important together, but I'm just excited for this new era. It's a wonderful new tool, and thank you so much.
Thank you for having me.